Welcome to the HR Community Podcast. My name is Shane O'Neill, founder of Civitas Talent, the HR and HSE recruitment community. Each episode we will host HR leaders and discuss their journey and discover best practice HR solutions across the HR industry. Whether you're a CEO, HR executive, or operating across the wider HR space, this podcast is for you. Please like and subscribe, and don't forget to comment and share your reviews. Enjoy the episode. Hi everyone, welcome back to another episode of the HR Community Podcast. This morning I'm joined with Rebecca Donaldson. Rebecca is the Chief People Officer for Ramsey Healthcare. Good morning, Beck.
How are you?
I'm good. Thank you so much for joining us on the podcast today. I know things are very busy in not only HR, but also in healthcare at the moment. So I know time is precious, so I really appreciate it. We've been sort of teeing up this podcast over the last couple of months, and I'm sure the listeners will really enjoy the conversation. But before we delve into it, tell us a little bit more about Rebecca Donaldson and who you were. Tell us a bit about your role. Tell us a bit about your current employer.
Okay, Rebecca Donaldson, long-standing HR or employment law professional. I've only ever really worked in the HR or employment law space. I've had a tendency to be attracted to businesses or organisations where there's a high level of unionisation and complexity around industrial relations. I sort of got my first really senior gig at a relatively young age with an organisation that was then City Rail. Have worked at the ABC, Qantas, and now I'm at Ramsey Health. Awesome. Ramsey Health, which I honestly hadn't heard of until I was approached about this role. So for your listeners' benefits, you may well have been in a Ramsey hospital without knowing it. But we are 76 hospitals within Australia. Yeah, wow. We're 36,000 people within Australia, 90,000 globally. We're the largest provider of private healthcare within Australia. We have hospitals, psychology, pharmacy, allied health, the full gambit in terms of physiotherapy and rehabilitation. And now we're moving more towards that notion of hospital in the home. Yeah. So we're the biggest and the best from a private healthcare provider in Australia.
That's amazing.
And a great place to work.
Yeah, no doubt. If you're there, Rebecca. The funny thing you mentioned there, you'd not heard of Ramsey before. I had heard of Ramsey, but now I'm starting to see the brand everywhere, and that's always the way, isn't it?
Yeah,
like I didn't realize there was the pharmacies and that side of it too, so which is pretty cool. Before it all began, I'll sort of take everyone back and your journey. I know you touched on it there, but you were a practicing solicitor. Tell us a little bit about that. Like what sort of motivated you to get into that, and obviously then transition into more of the HR side of things?
I started in HR. I did that, and this was much to my parents' chagrin. I left school in year 11 and started working, fell into HR, travelled for a couple of years, and that was back in the days when you could take leave without pay from your job and then come back to it. Came back into HR, had to go to university. I come from a family of academics, and they were mortified that I hadn't been to university. Went to university as a mature age student, did an arts degree majoring in industrial relations and political science, and was working in HR all that time, and started to realise that a lot of what we were doing had much more of a kind of legal bent or component to it than what I had initially anticipated. I was working full-time, studying part-time. I got to the end of my arts degree and thought, if I leave now, I'll never study again. So I thought it better to just keep going. So I went on to do a Masters of Law. I had my kids in amongst that, and was just provided with an opportunity from a wonderful woman that I'd worked with in the past who needed a part-time workplace solicitor, looking after safety and workplace relations. And I was job sharing with another lawyer. And I honestly, if you'd said to me, law's a great profession to do after you've had babies and on a job sharing basis, I'd tell you had rocks in your head until I did it. And it actually was the perfect return to work job. The lovely thing about working as a solicitor is your case notes and all your notes have to be up to date. You have to be on top of everything, and everything has a really logical continuity, particularly when it involves litigation. So it's really ripe for handing over to someone else to pick up when you're not there. So once our client group got comfortable with the fact that they could either have Teresa or Beck, depending on which day of the week it was, and that took some education, it actually really lent itself well to job sharing and part-time work. So did that for a few years, and then back into the throes of HR once my kids were a little bit older.
Fantastic. And you've obviously worked in a lot of highly regulated industries from, you touched on some of them earlier, from aviation to healthcare. Talk to us a little bit about that, particularly, I guess, from a HR perspective and even from a legal component, because I'd imagine there's a pretty transferable blueprint there when it comes to a highly regulated industry and a highly unionized industry.
I think that's true. I think, and whenever I do any of those personality assessments or diagnostics, weirdly, I'm not cautious. So it's really interesting, or I tend to be a little bit of a risk taker. So it's really intriguing to me, and I need to unpack it at a time when I'm feeling more self-reflective as to why I'm attracted to that sort of work. I have always worked with transport, aviation, healthcare, as you say, highly regulated areas. I wonder if it's just a case of you get used to it and you don't know what you don't know, if that makes sense. I think what I personally bring to it, and I think is quite a good, a nice combination of the legal and the people, is that idea of I start with the legal or the logical. I always go straight there, and sometimes that's really useful, particularly when there are emotions involved or highly volatile situations or the potential for people to be hurt, upset, or whatever the case may be. I start there. I look at what's logical. I look at what's appropriate or what is kind of compliance, I guess, and then I overlay with the people stuff, and then I take a more pragmatic approach once I factor in the realities of the individuals involved or the broader context, if that makes sense. But it gives you a good grounding or a good place to start and then work from there. I'm too old now to think that everything is black and white, and I recognise that it's not, but it's good to have a place to start when you're making assessments or decisions or looking at the way to take something forward.
Yeah, and it's really interesting when you've had that self-reflection on yourself as well, not being too overly cautious, because I think your experience in legal would obviously bring a lot of risk management and compliance to the table. But I think it's important not to be too cautious at times, particularly in a HR leadership role where you kind of have to make that decision, and sometimes you've got to trust your gut and take a risk as well.
I think that's true. Otherwise, things will just grind to a halt, or you end up sort of spinning your wheels. And I think we've definitely seen a movement within the HR profession away from just being the policy police, if you like, and one into where we can influence more around the cultural change required in organisations. And that requires a level of, I guess, I don't want to say intuition, because I think that downplays it. I think it's actually just the skills that you acquire by working with and for and around a lot of people. And you do learn to read the room well, you learn to influence better, and you learn to understand what is paramount from a compliance perspective and the areas where you can take a little bit of a risk.
Definitely, yeah. And are you seeing it as well, Rebecca? Obviously, you're touching it there as well with HR traditionally being more of a policy focused role, and now it's evolved. Obviously, there's a lot of legislation changes happening with wage compliance, right to disconnect, psychosocial safety. Are you seeing that shift now in businesses where HR are implementing these policies, but in a more strategic way where, there is that ability to influence, we are upskilling the workforce. It's a bit more of a strategic, I guess, approach now than we've just created the new policy, let's roll it out.
Definitely. And I can remember conversations early on in my career, and the whole idea was that if HR did well, we'd do ourselves out of jobs because managers would be so amazing and leaders would be, these amazing, full and wholesome leaders. And here we are circa 25 years later, and HR profession's bigger than it's ever been, and we get together all the time and the issues remain, I think, even more relevant and certainly more complex. I think, we're influencing within our organisations, but also externally. When I think about the involvement of HR professionals in things like the Business Council of Australia, or at forums where we're talking about public policy as opposed to internal policy, where we're having a profound impact on the shaping and drafting of legislation at a strategic level rather than just driving the implementation within our organisations. I think CPOs at the top table now, we don't just pipe up about people issues or talent or performance, but we're expected to have commercial acumen and to understand the business and to have views on the business in its entirety. The best leadership teams are ones where we're not siloed and only having a view on the areas for which we have a direct remit, but where, as a team, we're focused on the business fully and the strategy of the business, and the people strategy fits in within that rather than is off something off to the side, policing policy and being the moral police.
Yeah, it's a really good overview, and I think, I recall many years ago having these kind of conversations, and there was this real push for HR to get a seat at the table, and that seat has just evolved as well to in some organizations several seats, which is great, and yeah, the commercial acumen bit I think is so critical, because the business needs to see an ROI, and I think the business needs to really unpack, okay, how much is this going to cost us, and what is the overall ROI? And if that cost is financial, or if the cost is actually we're going to lose people, good people, I think the business are a bit more invested as well.
Great. It's bad news for those of us that did arts or law, because we really didn't want to do maths or stats. We can't get away from it. Data is king. But I think where HR adds to that is we are, as a profession, generally good storytellers and great at creating a narrative and bringing to life data and putting the people around that data. Data is only as good as what you do with it, and I think that's where HR really do excel. We can really shine in taking data, building some insights, and creating a narrative for the organisation around that data and why it matters.
Yeah, and it's interesting you touch on data there as well, because a lot of the leaders that we've had on the podcast, or even in some of the workshops we've been running, those that have had the most success, I guess, is the best way of putting it, the most success when it comes to transformation or future work ready strategies, it's all been centered around data, understanding the data, using the data, and implementing that into your strategy. Is that something that you've sort of personally started to really get invested in over the years?
Absolutely, and have for some time. And I can't stand an Excel spreadsheet, trust me, but so many organisations run on them. But as I said, it's kind of bringing, and I have to remind myself of this as well, because my eyes do roll back in my head when I think about yet another Power BI dashboard. But it's about taking that and making it real for people, making it real for ourselves. And I think you mentioned earlier, demonstrating the ROI on HR initiatives and programs is vital. That's a game changer for us. So it's no longer just being, the thing that we always used to say is, oh, well, it'll reduce attrition. And then we try and put a number on what attrition costs, and we try and point to why diversity initiatives matter, because they're the right thing to do. Now we can drive those conversations with very real data and demonstrate the success of our programs and our initiatives.
And I think as well, Rebecca, it's interesting because not that there's any industry or organization that is, I guess, less important than another, but healthcare in particular, I mean, it's up there with one of the most critical, if not the most critical sector in Australia and possibly the globe. But there are discussions around, clinical shortages and talent shortages and that real competition for talent. So do you think that kind of strategic HR element with the data will really start to help not just Ramsey, but the healthcare as a sector, I guess, start to plan for the future?
Absolutely, absolutely. And I wish I'd nailed strategic workforce planning better than I have. If I'm really honest, it's an evolving thing for us, and I've yet to see it done really, really well. And I think it means a lot of different things to a lot of people. For us, it's the right skills mix in the right hospitals or the right facilities at the right time. But where I do feel like I've got some more work to do is what that workforce looks like once you throw in the technological change that's coming our way. Now, clinical staff will forever be necessary, but the number and quantity of those clinical staff and where they are actually located and where they're appointed will absolutely change. The beauty of Ramsey is we have a global reach. The nursing shortage is real, and it's real globally, but we do have the advantage of being able to move resources around the globe. Again, we need to get better at that, and we need to try and exert some influence around the visa and migration hurdles to that, but we are getting better at facilitating more moves around the globe.
Yeah, great. And I'll be first to admit I'm by no means an expert in this space, but I am truly interested in it. You've been on panels and attended some events, well, in recent years, but throughout your career, but in recent years, and there's been a lot of talk around AI and technology. Beck, like talk to us a little bit about that. I mean, where's your head at with it all when it comes to AI, and sort of what are you seeing or hearing around the traps?
I've gone from being skeptical to really excited, and did it relatively quickly. The excitement for me is twofold, one in the clinical space and one in the HR space. In the clinical space, when you think about the number of interactions that a person or an individual or a patient has with its various medical providers or clinicians, they can be numerous depending on their particular journey. But if you think about a standard cancer patient, the interactions with the number of people throughout the span of their treatment it's within the hundreds, and so the note taking and the documentation associated with that is next level. So to be able to use ambient listening to capture those conversations and record really good comprehensive notes, and then spit out a summary that you can hand over to a patient who may during the course of that conversation being quite upset, or you get to that point where you stop listening because you've just heard cancer and you don't listen much beyond that because you've leapt to the future, and you're panicking about what that may be. To be able to take away a summary of that conversation, digest it, share it with your loved ones, I think is groundbreaking, and not rely on and all the generalizations about doctors' handwriting. They are true, and that sometimes that's just because they've got terrible handwriting, and often it's because they're writing in a hurry. But to be able to do some of the amazing things with ambient listening and AI note taking and stuff, I think is next level. We'll add to the patient experience, we'll add to the worker experience, we'll add to accuracy, and we'll improve safety. So I'm really excited about that. In the HR space, I think it's an opportunity to get rid of some of the kind of more mundane administrative process work that we do around recruitment, around investigations, around policy review. We've recently been using it to take some of our policies and have used AI to create some fantastic training outlines, which we can then, use to develop sort of and improve our compliance training. We've all had the horrendous online compliance training experience where you start and you click through, 4 hours of the essential and very dreary online training before you commence in a workplace. To be able to sort of zhuzhy that up a little bit, make it faster, make it more succinct, and more importantly, change it really quickly whenever a policy changes, I think is only going to make life more interesting for HR professionals. It means we can start to do the stuff that we don't have time to do because we're burdened by the administrative. So 100%. I feel really optimistic about it.
Yeah, good. And I know we had a similar conversation before. So, I'd agree. I'm definitely a big advocate as well. And I think as well, it's interesting when we talk about these kind of things, we talk about the evolution of HR and the workforce and the demands. And I truly feel like AI is probably not the only approach, but probably one of the key approaches that we can start to implement into our business to support that demand, because
Great.
like
Agreed.
it's just unbelievable, even from a recruitment perspective, the
Yeah,
demand
yeah.
that's out there for talent, for
Mm.
communication as well. You know, if a candidate applies to a role and they've not heard back in 24 hours, it's almost like you've lost them due to
Yes.
experience. So
Yes. Yes.
it's that ability to keep up, I guess, with the demand. And then yeah, we use a lot of data as well. I'm not a big fan of spreadsheets, but luckily we've got tools now that can spit out a spreadsheet in a couple of seconds, and then it doesn't take me long to sort of get my head around it. So
Good.
I enjoy more the storytelling part of that
Yeah.
than I do doing the analytical side. But yeah, but we've got our team that do the analytical stuff in line with the technology and the AI and stuff that's available. So I think it's really cool.
Do you find, can I ask you a question, Shane? Do
Go for it.
you find that people talk about AI skills and capability as part of their sell when they're pulling together their resume or their skills and qualities for a role? Is that something that people hone in on now?
You know what's interesting in HR? Not really, and I think not really should be not enough. I feel like even though it's not a completely new element, I feel like HR are maybe only starting to go through this exploratory stage. So in the future, absolutely, I think organizations will have AI as part of their critical requirements for any HR job description. Talent acquisition probably leverage a little bit more in their CVs, I would say, or talk a little bit more about it. But it's interesting. It's a good question because on it's some of the meetups and the workshops and stuff we do, you've got one half of the room who are a bit like, oh, I don't really like CVs that come through that are AI generated, or that touch on AI. I really want that human element. Whereas others are like, I just like the fact that they've invested the time to utilize the technology and the AI and stuff that's available to them. So I think we're going through that debate at the moment. But me personally, look, I definitely think that it should be talked about more in people's experience and
Mm,
profiles,
mm.
because I mean, weirdly enough, I seen the other day on LinkedIn someone was looking for a change manager and it said like dash AI, and I was like, well, that's cool because that's going to
Yeah,
be the
yeah,
next sort of
yeah,
transformation that we
yeah,
go through. So yeah, I
yeah.
don't see enough of it, but I think look, using it in the right way as well. I think this is where people really need to start leveraging the research that's out there.
Yeah.
Start to learn about what AI tools you can use for example, your job application or your resume, but then really assess what it's actually creating for you based on your information, and really tailor it and customize it, and bring that authenticness to it, because we see it all the time. You see a generic cover letter and a CV that's come through that's just been, put through the ringer on ChatGPT, and it's never going to really impress you that much. Whereas if someone uses it and then has their own flair and
Yeah.
authenticness to it, I think that's a totally different topic.
I do wonder because I don't think HR professionals, I don't think we're very good at blowing our own trumpet. We're
No.
crap at, we're really bad at seeking salary
Yeah.
reviews. We're great at telling other people how to do it. We're really good at advising other
Mm.
people on how to make their resume look fantastic, or how to build networks and promote themselves.
Mm.
But I think it's a gross generalization, but I think as a profession, we're quite kind of humble, and
Yeah.
we take a step back rather than forward, which I think is intriguing.
It is, yeah, it is so intriguing, yeah. And look, we may get better at that. I think I agree with you. It's a bit more of a humble profession at times, and maybe we just feel it's our duty at times, and it kind of goes over our head. But
We've always
it's
been the support,
yeah,
like,
yeah, for sure, 100%, yeah. And I think it's that mindset change, because
yeah,
I'd imagine, look, if there's any CFO listening to this, huge advocate for what you do, but like CFO is very, very easy to demonstrate and talk about how much revenue they've saved the business or whatever. So
absolutely.
I think we should take a leaf out of their book. But yeah, it's interesting. Some of the workshops we've been doing as well, like, and they're very much like private dining. It's a couple of hours. We unpack different topics. It's amazing to hear some of the stories where some of the HR leaders in the room are really driving transformation and technology and AI
Absolutely.
changes for the business.
Absolutely.
And
Yeah.
I think over time, hopefully, they'll be a bit more vocal on what they've done. Because I think the more we all share with each other now, it'll just enable the next. Some people come to our workshops with that same view that you and I talked about earlier, being a bit skeptical, and I'm not really sure if it's going to do anything or change anything. And then, towards the end, they're like, yeah, that was a really interesting discussion, and now I'm a bit more keen to explore. And I think it's just that journey that people take where and I know I'm a bit like this too. It's like if I don't understand something, I'm not going to be as interested in it. But when I start to learn a bit more about it, how it can enable my role and our business and stuff, then I'm a bit more invested.
I couldn't agree more.
Awesome, awesome. Now I know we are tight for time, so I won't keep you too much longer. I guess the last sort of question I'd have for you, really, Beck, it's more of a curveball, but we talked a lot about we talked a lot there, and we talked a lot about sort of the past and the present, but sort of looking into the future. Obviously, we talked about how AI can really enable our functions. Do you see any, I guess, challenges or risks? I'm putting on your legal hat here again, but any sort of potential risks ahead for the adoption of AI or even the adoption of some technology out there?
Absolutely. I think it's got risk written all over it. And I think the issue about the sort of pace of change with technology is this constant quandary about how quickly you get on board and adopt, because you don't want to be left behind, but without the appropriate guardrails, governance and policy settings, it's this sort of tussle between the two. You want to do the right thing. You don't want to expose the organisation or its workforce, but you don't want to be left behind, and you don't want to shut down innovation and great ideas. And I think that ongoing kind of dilemma or push and pull is just a reality of working life now in a work world where technology happens at such pace. I think maybe what we have to be better at, or maybe what organisations have to turn their minds to, is either buying in advice or having as part of your teams people who do nothing but keep your eye on keep your eye on the future, and who push through and who are tasked with pushing through the necessary policy reform in big organisations like mine, because otherwise we will be left behind. It's hugely risky. And I gave the example of ambient listening and clinical notes. Now, if you're a patient, to trust that an organisation is going to have somewhere in the cloud all that information about you as an individual, your health, sometimes your psychosocial information about your family, and to look after it, is a massive leap of faith. And the first time we get that wrong, I think could potentially be quite, I don't want to overstate it, but if it goes wrong, and it goes horribly wrong or falls into the wrong hands, like any cyber risk, that is potentially quite alarming. But if we don't do it, we're just going to stagnate and stand still, and we won't reap the benefits. So I think there will always be this push and pull about how far do we go, how much do we trial it, how much do we let things go and our workforce do things, and how much do we regulate, and how many governance frameworks do we put around it. And we have to get those frameworks working faster than what they are at the moment. Hopefully through doing more and more of it, we'll get better at it.
Yeah.
But we absolutely have to have an eye on that stuff.
Definitely, yeah, and then I think trial and error is going to be critical. I mean, trial and error, I would approach with a double-edged sword. Just given some of the examples you shared, I don't think I would do trial and error with someone's medical records, but I think trying and testing certain applications and platforms in more, I guess, less risk averse or less risky areas of the business. But you touched on cyber there as well. I think that is definitely critical. I think critical for any business now. I mean, as the world of technology and AI and whatnot is evolving,
it has to be the number one risk for most organisations, I think, at the moment, wouldn't it?
I definitely think so. And as it's evolving and it's hot on the agenda, so is the darker side of things. There are professional hacking organizations and businesses all across the world, and they're looking at this as an opportunity to try and tap into something there as well. So it's about setting up the the barriers, I suppose, or the exterior walls, so you can really start to play around with it internally. But yeah, that was really good. I am mindful of the time, like I said earlier, so I won't keep you too much longer, Beck. Thank you so much
My
for
absolute
jumping
pleasure.
on. That was amazing. And I hope, and I'm sure everyone that was listening enjoyed the conversation. Feel to reach out to me or Beck, or connect with Beck on LinkedIn if you want to sort of evolve the conversation. But no, thank you so much.
So have a lovely day.
Thank you for tuning in to the HR Community Podcast. Remember to like and subscribe and share your views and comments below. This podcast was brought to you by Civitas Talent, the HR and HSC recruitment community. Whether you're a candidate looking for a new role or organization looking to secure brand new talent for your team, please get in touch with us today. Thank you.